Hello, my name is Amanda and I'm the speech and language therapist on the neonatal unit. I'm here today to talk to you about the ways that a speech and language therapist can help you and your baby during their stay on the neonatal unit. Speech and language therapists can support you and your baby with your early interaction, communication and bonding together. We can help you read your baby's cues and give support and guidance on how to respond to your baby at various stages of their development. We also provide support with the early oral experiences, supporting with transition from tube feeding to oral feeding. And if your baby is having difficulties with feeding and swallowing, we can do further assessment and give some guidance on how to make the feeding process easier for you and your baby. It's important that we support language development in the NICU. When babies are born early, we know that that early period of language development is interrupted. We know that babies in the womb start listening to mom's voice from the age of 22 weeks on. So when this is interrupted, your baby can be at risk of delays in language development later on. So we try to give support and ideas on how to provide a language-rich environment at suitable times for your baby during their neonatal stay. Babies younger than 32 weeks will sleep most of the time. Babies know your voice, and when they are ready, you can talk to them gently. Usually it's best to talk to them gently before you provide any touch, so they can anticipate that the touch is going to happen. The nurses will help you hold your baby close and do some skin to skin. We try to minimize loud noises at this time, and your gentle voice when you're singing and talking to your baby is calm and reassuring for them. From 32 to 35 weeks, your baby will start to show more interest in your face. They cannot necessarily make eye contact at this time, but during their awake periods, they're ready to engage with you. Again, you can offer little finger hugs through the porthole, get close to the porthole and talk to your baby in the incubator, and enjoy some reading and singing during their awake periods. From 36 weeks on, your baby is starting to show more interest in having social interactions with you. They are beginning to seek out your face and gaze. And during this time, when they are alert, it's an ideal opportunity to try some book reading with your baby. Sing familiar songs and talk to them about what you are doing during their cares. Watch carefully for signs that your baby may need a little rest, because it can be tiring for them during these interactions. After discharge, your baby loves listening to your voice, and at this stage you're beginning to notice when your baby is trying to communicate with you. It's really important when you bring your baby home to repeat, repeat, repeat. Use their name often, repeat words and familiar songs and stories. Limit the screen time, read books every day, talk or sing anytime, and remember to be face to face with your baby. During your time in the neonatal unit, we are there to help support you with the transition to oral feeding with your baby. When your baby requires significant respiratory support, they will be fed by a feeding tube. In the feeding tube may be your breast milk or some formula milk. It's important to start before you start. Ideally, pre-feeding skills would start long before your baby has had their first feed. To develop pre-feeding skills, give your baby opportunity to be handled, to practice sucking, to have some time skin to skin, and to have their first taste. You can start with the pumped breast. This gives your baby the opportunity to become familiar with the breast without being under pressure to swallow volumes of milk. You can also try using the soother or the dummy to practice non-nutritive suck. You can give a little taste on the soother or the dummy when your baby is ready by dipping it into some breast milk or formula. And similarly, you can dip your gloved finger in and give baby some practice at sucking the formula or the breast milk from your gloved finger. As babies develop, they will start to improve with their coordination of suck, swallow, breathe. But we know on average it can take babies up to 36.5 weeks to achieve this skill successfully. It's important when you start to introduce oral feeds at the breast or with a bottle that you watch out for your baby's stop and go signals. Go signals include when your baby is awake and alert, actively sucking and bringing their hands to their mouth. They're showing you that they are ready for an oral feed. Stop signals include when the baby starts to clamp their lips, refuse the feed, arch their back, turn their head away from the bottle, or you may see some other signs that the baby is struggling with their feed. For example, difficulty with breathing, drop in oxygen saturations, or change in their skin tone or colour. If your baby is exhibiting some of these stop signs, stop feeding and we can consider other methods. So it may be important to go back to some of those pre-feeding activities that you had been doing to further develop your baby's feeding skills. Or we can try some strategies to make the oral feeding experience easier for you and your baby. These can include positioning, pacing, swaddling, or altering the flow of milk for your baby, either at the breast or with the bottle teat. Elevated sideline position is one of the positions that we can use to support babies when they are having difficulties with regulating their breathing or heart rate during feeding. You may sometimes swaddle your baby during the feed because it helps them to organise themselves when they feel more contained, like the feeling of being in the womb. However, some babies do not like to be swaddled, and therefore it's important to observe your baby and follow their cues. For elevated sideline feeding, we typically lay babies first on the left-hand side and offer the feed on the right-hand side. But it can be important to rotate the position of your baby for feeding so that over time, so they don't develop a preferred position. So for the purpose of this demo, I'm going to turn the baby on the right-hand side so that you can clearly see the feeding position. We call it bum to tum feeding in our unit because I often remind parents to ensure that baby's bum is right in at the feeder's tummy. You just rest your hand gently on baby's back and encourage their hands into the midline. We try not to hold baby's head during the feed, and this means that they can pull their head back whenever they need a little break from sucking the bottle. By being in this position, I have used a higher footstool with my pillow across the knee to support the baby. My knees are higher than my hips, which ensures that baby's head is above their bum. And this means when feeding baby, any milk that spills should spill from the front of the mouth and reduce the risk of choking on the milk. It's important to hold the bottle horizontally. Don't tilt the bottle like this. By holding horizontally, it's easier for baby to manage the flow of the bottle. For the purpose of this demo, I have now turned baby to the right-hand side and I'm feeding with my left hand to give the experience of being in a different feeding position. We use paced feeding to help babies regulate their breathing. Regulated pacing can be used in the early days of transitioning to oral feeding. That means that you pause or lower the bottle after every 3 to 5 sucks to ensure that baby gets an opportunity to breathe. So I'll just give a little example. 1, 2, 3, and lower the bottle for baby to breathe. 1, 2, 3, and lower the bottle for baby to breathe. As you can see, I'm holding the bottle horizontally so that the baby is working on suction to transfer the milk. If there is any spillage, milk will spill at the front of the mouth, which is safer for baby. You may have to remove the bottle sometimes when baby sucks so hard that it can be difficult to lower the bottle to give that opportunity to breathe. The hope is that in time, babies will increase their suck, swallow, breathe coordination and will learn to pace themselves on the bottle. We also have pacing that's called responsive pacing, and that supports well when you're transitioning babies who are developmentally ready onto breastfeeding. That is following the baby's suck, swallow, breathe rhythm and lowering the bottle whenever they're ready to take a breath. For some babies, this could be 10 sucks and then lower the bottle to take a breath. 10 sucks and lower the bottle to take a breath. By using this method, we are supporting baby to learn to coordinate their suck, swallow, breathe. The other thing to consider is the teat flow. Typically, babies who are born premature require slower flowing teats to manage the ability to coordinate breathing during feeding. It can be tempting to use a faster flow teat because people feel that that makes the feed quicker and more efficient. However, by using a slower flow teat, it's supporting those babies who will be transitioning to full breastfeeds when developmentally ready. And also it helps to develop suction during the feed. As speech and language therapists, our goal is to support you and your baby to have a comfortable and enjoyable feeding experience. All feedings should be infant-led. And if you have any concerns about your baby's feeding after your discharge from the neonatal unit, please do not hesitate to get in touch with the Speech and Language Therapy Department for further support.